This is WFYI News Now. It's October 6th, and I'm Abriana Herron. On today's show, former NFL quarterback Mark Sanchez charged after a downtown Indy fight left him hospitalized. The YMCA of Greater Indianapolis launches a fundraiser for low-income families. And an increase in ICE arrests have led to some people avoiding healthcare visits, while others worry about the negative health impact of fear for immigrants living without legal status.
This kind of constant low-lying fear is often referred to as toxic stress, and studies have shown that it can lead to anxiety, depression, and PTSD.
Those stories coming up, but first, the Indianapolis City County Council will vote to approve next year's budget tonight. The proposed budget is the largest to date, hitting $1.7 billion. It also comes with expected losses in funds following state lawmakers' cuts on property taxes. To balance the budget, most departments outside of public safety were asked to trim about 4% from their spending plans. Former NFL quarterback Mark Sanchez was charged after a downtown Indianapolis fight over the weekend that left him hospitalized. Eric Weddle reports Republican state leaders prematurely blamed the incident on crime in the democratically controlled city.
Sanchez, now a Fox Sports analyst, was stabbed during an altercation early Saturday with a 69-year-old truck driver. The driver was also injured. On Sunday, prosecutors charged Sanchez with 3 misdemeanors, including battery. They allege he confronted and attacked the other man. The case made national headlines before police confirmed Sanchez's arrest. Governor Mike Braun and Lieutenant Governor Micah Beckwith posted, then deleted, social media comments blaming Indianapolis leaders for public safety problems. Their offices did not respond to WFYI's request for comment. I'm Eric Weddle.
The YMCA of Greater Indianapolis launched a fundraiser last week to help foot the bill for child care for low-income families. Dylan Pierce-McCoy reports the nonprofit is aiming to make up for dramatic state cuts to child care funding.
Indiana helps pay for about 350 children to attend before and after care or daycare with the Indianapolis YMCA. But earlier this month, the state announced it would dramatically cut vouchers. The YMCA must either make up the difference or ask families to pay amounts that can add up to around $200 per month.
You add that up for the month, and that could be groceries, that could be gas money, that could be just making some really tough decisions.
That's Natasha Bellick, the Vice President of Youth Development for the YMCA of Greater Indianapolis. She says the nonprofit hopes to provide funding so families don't have to bear that cost. To do so for the rest of the school year, it must raise $750,000. I'm Dylan Pierce-McCoy.
And for our final story today, early this year, President Trump rolled back a policy that kept federal immigration agents from sensitive areas like schools and medical facilities. According to a report from Axios, there has been a 127% increase in ICE arrests in Indiana from January to June of this year. Doctors and others worry this will have negative health impacts on some of the 11 million immigrants here without legal status. Lizzie McGreevy sat down with Ryan Levy, a reporter with Trade-Offs, to talk about how fear is keeping people away from the doctor's office.
Can you just start by telling us about the impact of this constant fear of deportation on immigrants in America?
Yeah, absolutely. So research shows that this constant fear of deportation can harm people's physical and mental health. And this is especially true in kids. This kind of constant low-lying fear is often referred to as toxic stress. And studies have shown that it can lead to anxiety, depression, and PTSD, as well as increased risk of infection, diabetes, heart disease, asthma, and cancer.
So as a result of this fear, some immigrants are not attending in-person health appointments, right? So what are experts saying about how this impacts the health?
Yeah, so I talked with more than a dozen people who provide care to or study the health of this population. One clinic in Chicago told me that they've seen a noticeable jump in the number of people canceling or not showing up for appointments, as well as a big spike in people not picking up their prescriptions, especially at times when immigration enforcement is in the headlines. And these experts told me that they're really worried that people who stay away could see their chronic diseases like diabetes and hypertension get worse, and that folks could miss critical preventive care like immunizations and cancer screenings. Cancer screenings was something that we saw be an issue during the pandemic, during the COVID pandemic, which was another time when we saw a lot of people avoiding care.
So it's been difficult and expensive for members of this community to attend routine appointments generally. So Ryan, what can you tell us about how this moment is different from how people without legal status are accessing or weren't accessing care before?
Absolutely. Folks without legal status are generally unable to access health insurance, and they've always had to be worried about law enforcement. But several providers told me that this moment feels different, even different from Trump's first administration, really just because of the scale and scope of immigration enforcement that we're seeing right now. They said it felt more like COVID, when they had to rethink everything they were used to doing in order to care for their patients.
Ryan, you mentioned COVID, so naturally I had flashbacks to all of the times I was sitting in my home office, having virtual appointments with my therapist, with specialists. Is this something that can still be extended to immigrant patients? And what are some of the other tools hospitals and providers are using to help people who are too afraid to attend in person?
Absolutely. Steph Wilding, who runs that clinic in Chicago I mentioned earlier, which is called Community Health, she told me that they've been doing a lot more telehealth and also reminding folks that, other people can pick up their prescriptions, just generally trying to find ways to put folks at ease. We're also seeing a lot of places train their staff on what to do if ICE shows up. They're rearranging their waiting areas to be less public. And the biggest thing that I heard kind of over and over again was providers are trying to communicate to their patients that it is safe for them to come in and it's important for them to come in. Though Steph and everyone I talked to also acknowledge that there's a limit to the safety that they can promise their patients right now.
Ryan, thank you for this information.
That's all for today's episode of WFYI News Now. Our podcast is produced by Zach Bundy, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music, and I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, TikTok, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.